My name is Dr. Marty Kotler. I want to thank you for attending this webinar on prior authorizations, pre-certifications, and medical necessity review forms. Just a quick disclaimer before we get going. The information in this webinar is for educational purposes. It's not intended to substitute your thorough clinical decision making. It's not intended to substitute your billing protocols. It's not intended to be legal advice. Target coding does not provide legal services. CPT is a registered trademark of the AMA, and every attempt has been made to make certain that the information in this program is 100% accurate. However, it's not guaranteed. We have a lot of people listening to this webinar today. Some of you are past attendees of our webinars and seminars. Some of you are members of Target Coding, and some of you are brand new to my company. You might have no idea who I am. So let me tell you a little bit about myself. Again, my name is Dr. Marty Kotler. I'm a chiropractor. I practiced for 16 years prior to starting my company, Target Coding. I'm also a certified professional compliance officer and a certified billing and coding specialist. That's what all those letters are after my name. My area of expertise is in billing, coding, cash practice, compliance, documentation, durable medical equipment, risk management, record keeping, Medicare, and HIPAA. And I'm kind of unique. Let me tell you why. Most doctors are not certified coders. Most certified coders are not doctors. So you'll see during this webinar how I combine both specialties to help you improve productivity, maximize reimbursement, reduce administrative burden, and show you how to get paid for everything you do. Target Coding has been helping thousands of doctors and their staff members for over 15 years with our exceptional products and services. Okay, Target Coding members, you will be able to receive a certificate of attendance. If for some reason you can't make it through this entire webinar, you get bored, you fall asleep, you want to listen to it another time, you're going to get the playback recording. You can get all the PowerPoint slides if you would like, and all the forms. I'm going to be showing some sample forms during this webinar. So Target Coding members, after the webinar is over, just log into your account, get your certificate of attendance, get the playback recording link, PowerPoint slides, and all the forms. By the way, download that certificate of attendance. Just in case the coding police come knocking on your door, you can use the certificate of attendance that you take billing and coding seriously and you care about preventing fraud and abuse. Any questions so far? Email info@targetcoding.com and one of our staff members will get back to you right away. All right, let's begin. Prior authorizations, pre-certifications, and medical necessity review forms. These items relate to in-network doctors. If you're out of network, you may be affected by some of these prior authorization forms, but when you're out of network, you don't have to fill out any paperwork if you don't like to, if you don't want to. So in-network pros and cons. Let's begin with credentialing and contracting. Those of you that have been in practice for a while, you should know the difference between in-network and out-of-network. And there are pros and cons to being in-network, pros and cons to being out-of-network. I'm not going to tell you to join any plan. I'm not going to tell you to drop out of any plan. That's a business decision you have to make. So when you're in network, you'll have to go through credentialing and then contracting. Fee schedules are different in and out of network. Deductibles are different. Credentialing. Those of you, now I know we have brand new doctors of chiropractic just starting in practice. You need to get an NPI number. First, go to the INA website, Identity and Access Management System, then you'll get your NPI number. Those of you that are in network, you should probably set up an account in CAQH, that's a secure central database. There's all different forms you need to fill out if you want to see Medicare patients, Medicare Part B, those are the patients that come in with the red, white, and blue cards. You need to get enrolled. It's another question we get at our help desk. Dr. Kotler, I don't bill Medicare. I'm not in Medicare. I just have patients come in. They pay me cash. I don't have any relationship with Medicare. Well, you can't do that. Cannot do that. There's no glitch in the system. There's no way around it. If you want to see patients that come in with those Medicare Part B red, white, and blue cards, you need to be enrolled and submit the claims. If you're just seeing patients and you're just taking cash from your Medicare Part B patients, you're risking a problem. Don't do it. So here's some of the major managed care. I call them third-party administrators or managed care plans. OrthoNet, Whole Health Living, Whole Health Pro. Some of you have to work with Carelon, AIM, Avicor. Those of you in Ohio listening to this, you know CareSource, you know that program. Those of you in Minnesota, you deal with Fulcrum, Medica, UCare, Health Partners. Here's the big one, Optum and ASH, American Specialty Health. So let's go over forms. New patients have to come in and they fill out forms. Whether you're in network or out of network, patients need to fill out forms, financial forms, very important. Forms protect you from malpractice cases, from patients complaining about fees, from state board complaints. Have good quality forms. Do a form scrubbing. Every year, scrub all your forms to see if they're up to date. New patient forms. Yeah, here's a sample new patient form. Make sure patients fill out, staff members listening to this, make sure patients fill out every section on every page. Make sure every page of these forms has your office name, address, and phone number. I'm not saying this to give you a hard time. I've worked with hundreds, maybe even thousands of doctors over the past 15 years. I don't keep count. I have a few clients that have had state board complaints, and the state board said you have to have your office name, address, and phone number on every page of your intake form. I'm telling you things to prevent problems. I want you to avoid problems. I want to treat all of you, you're my kids. I want to put a coat of armor around you. Here's another thing we see, a problem. Your intake form, it probably says, what's your chief complaint? What's your reason for the visit? Many of the doctors we work with have social media special promotions where they're offering a free exam. So here comes Mrs. Smith. She's filling out your paperwork under chief complaint or reason for the visit. She puts free exam. That's not okay. Staff members give the form back to the patient and tell them to write neck pain, back pain, whatever the problem is. If you're in network with ASH, you could use their intake form. Those of you that are in network with ASH, you're probably familiar with ASH Link. That's the website, that's the hub, that's the portal. You can download all their forms. How about a HIPAA form? Make sure you have a good quality HIPAA form. If anyone would like target coding sample HIPAA form, send us an email, info@targetcoding.com. We'll send you our sample HIPAA notice. Every patient needs to get a copy of it. Just having it posted in your waiting room is not enough. Actually, it needs to be posted in your waiting room. You could put it in a frame and hang it on the wall. If you have a website, it needs to be posted on your website. Now, I know most of you don't do this. Now, I read a lot of laws, rules, guidelines, statutes, and many times they go, come on, we don't need to do this, do we, as chiropractors? We do. I don't make the rules, I just enforce them and explain them. So every new patient needs to see your HIPAA notice. You can give everyone a copy. If you want to save on paper, laminate one. If you're using paper forms, many of you have digital paperwork, so your HIPAA notice needs to be in there. Make sure your HIPAA notice talks about how you're going to share patients' information. Why is it important to let people know, patients know how you're going to share their information? In order to get paid. So post it on your website, in your waiting room. Some of the doctors we work with have television monitors that loop chiropractic messages. Put your HIPAA notice in there. Now, here's a question we get at our help desk. Dr. Kotler, we had a patient is refusing to sign our HIPAA notice. Can we still treat the patient? Yes, you can still treat the patient, but you should have a form. I have written over 500 forms. Now, I took my 100 greatest hits and I have them in a forms package if you are interested in learning more about our forms package, but this is the form. Patient refuses to sign HIPAA notice. What do you do? Here's another form. It's called the good faith estimate form, and it's based on the No Surprise Act or the No Surprise Law. You're probably familiar with this. The name says it all. You can't surprise patients with a balance due. You have to tell them how much things are going to cost prior to services being provided. Now, most of you do it. Most of you call it a financial care plan form. Great. You must have a financial care plan form. Patients must review your financial care plan form. Patients must know what services are not going to be covered by insurance. So for your cash patients, out-of-network patients, even if you're in network and you're going to do something like laser or decompression that's not covered, you need to let patients know in writing how much things are going to cost, and it has to be within $400 of the services you're going to render. See the document on the left side on your screen? Patients' rights and protections against surprise medical bills. That also needs to be posted in your waiting room. Patients need to know about this. Now, I know a lot of you are saying, Dr. Kotler, I've been to other doctors. I never get any of these forms you're talking about. I was in the hospital recently, Dr. Kotler. I didn't see any of these forms. I don't care what other doctors do. It doesn't matter to me when I hear. I just had a client of mine this morning say she went to a physical therapist and the physical therapist is billing out for 5 time-based codes and my client's only in the office for 30 minutes. And she wants to know, my client wants to know, are they doing things right or wrong? They're doing things wrong, not my client. I want to make sure my clients are doing things right. Patient rights against surprise medical bills also needs to be posted in your waiting room. Here's a good faith estimate form. Make sure your good faith estimate form, also known as your financial care plan form, have your NPI number, tax ID number, and the diagnosis. Take a look at, if you have one in front of you right now, take a look at it. I would bet a lot of money that you don't have your NPI number, tax ID number, or diagnosis on your financial care plan form. And some of you may be saying, I don't understand. Why do we need to have that? You know what my response is? I don't understand it either, but I don't make the rules. I just explain them and try to enforce them that clients that pay me money. So when you are giving somebody a care plan, many of you have a mix. Most of you are not all cash, all Medicare, all PI. You have a mix, which is nice, which is what we recommend. Now, some of you have cash patients where you offer these packages. Many patients would like to sign up for a 12 visit, 24 visit, 34 visit package. Fantastic. I love those packages. Now, most of the time when I review them, they're not compliant. They're violating the dual fee schedule rules. So if you offer packages, check with a compliance expert like me. If you don't have one, check with me. Let's do a free consultation. I'll make sure that your packages are compliant. Okay, ASH, back to ASH. ASH is one of the largest healthcare networks nationally. In many states, ASH works with Cigna and Blue Cross Blue Shield. When you're in network with ASH, you're in a tier. 99% of the time when I speak to a doctor that's in network with ASH, they don't know what tier they're in. You should know what tier you're in. You want to maximize reimbursement? You want to get paid for everything you do? Know what tier you're in. Now, I don't work for ASH. They don't work for me. I don't work for any insurance company, and none of them work for me. So the information I'm giving to you is based on my personal experience and practice and working with thousands of healthcare providers nationwide. If you're not sure what tier you're in, call 1-800-972-4226. So when you're in network, there it is, ashlink.com. You have access to their forms. You could verify eligibility. It's a great portal. So when you're in network with ASH, there's a process you have to go through. And this is part of, now this is a quick, free webinar. I have a 1 hour and 30-minute webinar that's not free, you have to pay for it, on how to managed care. And I go through ASH in detail. I'm not going to be able to do that today. We don't have the time to do it, but this is a care plan. If you're in tier 3, you should be getting about 17 visits approved. 17. This is the process. The first 5 visits are covered when you're in Tier 3. On the 5th visit, you need to have the discussion. Mr. Taylor, your insurance company covered the first 5 visits. When you come in on your next visit, we're going to do a re-exam and get an update. We're going to send in the paperwork, and we're going to probably get another 7 visits approved. That's been our profile. So that's 12 visits. On visit 11, you have another conversation with the patient and tell them that you're going to ask for more visits, unless maybe by visit 12, the patient has reached maintenance. Maybe by visit 5, the patient has reached maintenance. Mild condition, quick little complaint by a patient, 5 visits, transfer them to maintenance. Severe condition, you might be able to get 30 visits. Yes, we work with some doctors that are getting 25, 30, 35 visits with ASH. When you are in Tier 3, you need to fill out a form, either a paper form or online, medical necessity review form. And you have to go through these questions. So the example I have on the screen is August 1st through August 15th, Mary Jones gets her 5 visits. You tell Mary when you come in on your next visit, we're going to do a re-exam. So the re-exam is on August 16th. And now you're filling out the paperwork. From August 16th through September 16th, you're asking for another 12 visits, 2 therapies per visit, so that's a total of 24 therapies. That's how this form should get filled out. We know how it works based on our experience. Next, Optum. Optum works with United Healthcare. The in-network process is different. They have different tier levels. Tier 2 are new to the Optum in-network program. You're new, you haven't met the minimal patient volume, you don't have clinical decision-making in line with Optum at that point. So you have to go through what they call a utilization process. Now, Tier 1 providers, you've met the minimal patient volume. Now you've gone to the next level. You participate in a minimal utilization review process. Then after 2 years, you graduate to the Tier 1 Advantage program. No longer necessary to submit paperwork. Now the paperwork I'm referring to, you've probably heard of the patient summary forms. You want more information on how to go in network with Optum? There's the link, there's the website, myoptumphysicalhealth.com, myoptumphysicalhealth.com. So here are the key points. If you want to go in network with Optum, you need to fill out their participating provider agreement. You'll have to have a certain level of malpractice coverage. Basic questions about being in network with Optum, 1-800-873-4575. This is the PSF, the patient summary form. This form, there's just not enough room to build your case, in my opinion. The top third of the form is just patient information, their name, their address, their phone number, your name, address, and phone number. The little middle section on this form is where you're supposed to give them information about the patient. I don't think there's enough room in there. And then the bottom third of the form, the patient is supposed to fill out. I don't think there's enough room on this form. So submit additional paperwork. That's the answer. Submit your care plan. Now, those of you in Minnesota, they have their own pre-authorization forms. Many of them ask the similar questions: level of spasm, range of motion, limitations, neurological findings. These forms at least give you more room to fill out. ASH and Optum forms, there's not enough room. You have to attach your treatment plan and your recommendations. The questions are easy. It's, do you want to take the time to fill it out? In my opinion, you should take the time to fill out if you're in network. I mentioned 17 visits with ASH. The first 5 visits are covered. Then you fill out a form. I think the form would take about 30 minutes to fill out. You'll get another 7 visits. And then after 12 visits, you fill out another form for another 30 visits to get 17 visits. Is it worth your time and effort to spend 1 hour to get paid for 17 visits? I'll let you make that decision. Now, when it comes to your exams, it's called evaluation and management, exams and re-exams. Something came out a few years ago that came across my desk. It was called an initiative by the federal government, Patients Over Paperwork. This was a fantastic document. It outlined two things to help doctors reduce administrative burden. If you see it on the screen, it says this will help patients by allowing doctors to focus on patient care instead of paperwork. Yes, that's a good thing. And this document outlines how doctors should get paid for every minute you're with a patient. I know you agree to that. That's why the AMA had to update the guidelines. If you're familiar with my seminars and webinars on exams and re-exams, I always go over this, the two key factors, time or decision making. Get familiar with these. It'll help you maximize reimbursement. Some of the doctors I speak to, they complain, Dr. Kotler, I'm seeing the same amount of patients as last year, but I'm making less money. Something's wrong. Maximize reimbursement. That's what we do. We want to show you how to get paid for every minute you're with a patient. So if you're going to use the time factor, reviewing records and tests is part of the time. Documenting the encounter, that's part of the time factor. These are the time factors here, the time levels. If you're not using, most of you are not using time. How do I know that? I know that because I do chart reviews. About a third of my work week is spent doing chart reviews from chiropractors. I look at charts and I give my opinion on how you're doing. You don't want the enemy to be looking at your charts to go after you. You want a brother in chiropractic to be helping you and give you items to prevent problems. I review charts. I very rarely see the time listed. So you know what you're doing? If you don't list the time, you're defaulting to MDM, medical decision making. I call it CDM, chiropractic decision making. And that's based on the American Medical Association charts. These are right in the guidelines. These are so nice and easy to follow. It gives you the little breadcrumb trail telling you how to bill and code properly. For example, here comes Mrs. Anderson. She has mild neck pain. She gives the pain scale as a 1. You can't bill more than a 202 or a 212. Now, Mr. Johnson comes in with mild neck pain and mild low back pain. Now you got two problems. You're on your way to a 203. That's all it takes. Just follow the guidelines. If you're not familiar with these guidelines, attend one of our seminars and webinars. We'll show you how to do it. It doesn't take that long to to figure it out. I mentioned Ohio. Many of the doctors we work with in Ohio have to fill out care source forms. This is what it looks like. These are the pre-authorization forms, the prior authorization forms, the pre-certification forms, the medical necessity review forms. It all means the same. You have to fill out paperwork to get your visits approved. Now, I'm going to show you how to get more visits approved in a couple of minutes. This is for Ohio Medicaid providers. Whole Healthways, Whole Health Pro. This is their form. Get familiar with these forms. MedMutual, EviCore. By the way, we do credentialing. I mentioned earlier, I'm not going to tell you to join any plans. I'm not going to tell you to drop out of any plans. If you want to join a plan and you don't have the time or wherewithal to get in network and fill out the applications, let us do it for you. Our credentialing department is booming because so many doctors want to get in network. It's okay. My nephew was just starting a practice. He said, hey, Uncle Marty, should I go in network? I said, Justin, yes, you need new patients. That's that's the biggest pro of being in network. You'll get more new patients. We have a client. He's opening up his 3rd office already. He's only in practice 2 years. This guy is booming. He's a superstar. So every office he opens, we get his associate doctors in network with Blue Cross Blue Shield. That's it. He only wants to be in network with Blue Cross Blue Shield. He wants to be cash out of network with Aetna, Cigna, United Healthcare, Medicare. Only Blue Cross Blue Shield. We can do that. We can help you get in network with many plans. We can help you with CAQH, multi-plan, Medicare, Railroad Medicare, revalidation, reassignment of benefits. So yeah, this is a sample Visit 6 update. If you are in network with ASH, after 5 visits, you have to send in more paperwork. So this gives them the updated information. So diagnosis coding. Oh, of course, subluxation is the most common chiropractic diagnosis code build. Pain and symptom codes. These are very basic codes. You should be using M54.50 for basic, typical musculoskeletal pain. Don't use any other on the screen. These are basic codes. Muscle spasm. If you submit muscle spasm to an insurance company, you're not going to get paid more than 6 visits. It's a short-term treatment diagnosis code. You want to get paid for more than a few visits? Use good diagnosis codes like sprains. Sprains relate to ligaments, lumbar sprain, cervical sprain, sacroiliac sprain. Now, if you've been to my seminars and webinars in the past, you know how I stress the importance of making sure your documentation can support the clinical rationale. If you're submitting a diagnosis of sacroiliac sprain, have a little checklist. Subjective findings, orthopedic findings. What are the gold standard orthopedic tests for sacroiliac involvement? You see, this is where I combine my chiropractic experience and my coding expertise to help you know how to document properly and maximize reimbursement. Yeomans and Ganslins, you remember that from school? Sciatica is a long-term treatment diagnosis, but get specific. It's either right side or left side. And here again, have a checklist. Mrs. Williams is complaining of lower back pain and pain radiating down her leg. Orthopedic tests, Bechterew, straight leg raise, Kemp's, Fagerstein's. Neurological test, diminished reflexes, chiropractic test, antalgic lean. That's the stuff will help you get paid for more visits. Herniated discs, bulge discs. You're not going to see those in your ICD-10 list. You're going to see disc disorder, disc displacement. By the way, you have to have an MRI. If you're going to use a disc disorder or disc displacement diagnosis code, those are the codes that begin with M51. You have to have an MRI. Get detailed. You could use these add-on codes. These will help you get paid for more visits. Mr. Jones comes in with a herniated disc at L3, L4. You're reading the MRI. It shows he also has a tear, a large tear in the annulus at L3, L4. I recommend you add on M51.A2. Next patient, Mrs. Wilson comes in. She's got one of these managed care plans, and you want to submit paperwork. You want to get more visits? And you find out she has a herniated disc at L5S1 with radiculopathy, that's nerve root compression, and she also has some tearing, a small defect at the L5S1 disc, add on M51.A4. Do you want a list of the codes that pay for the most visits? I'm sure you're all saying yes. Many of you have my book. If you don't have my book, I think you should buy it. It should be part of every chiropractic billing and coding library. I give you the codes that pay for the most visits in chapter 1. There are 3 sections in the book. The first section gives you the codes that pay for the most visits. You get cheat sheets emailed to you. Section 2 pairs your codes. Your CPT codes are what you're doing. Your diagnosis codes are why you're doing what you're doing, and they should pair. So I go through that in chapter 2. In chapter 3, I give you that little checklist, give you 25 of the most common chiropractic diagnosis codes, and the orthopedic tests, the neurological tests, the chiropractic tests to support the diagnosis. I want to make sure that you're protected, especially in a malpractice case. You want to get more visits from your in-network plans? Report complicating factors. Let them know about comorbidities. Example, patient number 1 comes in with low back pain, that's it. Patient number 2 has low back pain, has type 2 diabetes, has peripheral neuropathy, which is causing numbness, tingling, pins and needles in the feet. That's causing difficulty walking. Difficulty walking is contributing to the chief complaint of low back pain. Let these plans know. Here's a whole bunch of these: flank pain, anxiety, fibromyalgia, difficulty walking, spinal stenosis, scoliosis. You want to get more visits approved? Use OATS, outcome assessment tools like the Neck Pain Disability Index. Give them the scores when you submit your paperwork. Oswestry, Roland Morris. These are great questions. Example, Mr. Thompson, can you put on your socks and shoes? 0 is extreme difficulty. 4 means no difficulty. Can you lift a bag of groceries out of the trunk of your car? Great questions. These are great forms. Have the patients fill them out. Now, I know some of you saying, Dr. Kotler, we see 100 patients a day. We don't have the time to have all these things filled out. Set up a consultation with me and I'll show you how to do it. Now, once you submit your paperwork, review the response forms. Here's a response form. It's called from ASH. This doctor asked for 12 visits, only got 6 approved. Asked for 12 therapies, all 12 were denied. Why? They give you the reasons on the next page. Read them and learn from them. By the way, how do you think I know all this stuff? How do you think I got certified in coding? I get that question when I do my live seminars on the breaks. A lot of CAs come up to me and ask me, how do you get certified? How do you know all this stuff? It's from reading all these books, reading all these manuals. Most of you would rather have root canal than read the Medicare benefit policy manual. I like reading these things. I know I'm unique, I'm different. We all have strengths and weaknesses. I don't find billing and coding boring. I love what I do. You could probably tell from the passion in my voice. I stay up to date on a regular basis with Aetna, Cigna, United Healthcare, Medicare, Medicare Advantage plans, Medicare Part B. I read all the chiropractic guidelines from Medicare. I contact state boards to make sure my clients aren't getting in trouble, like giving away free exams or treating peripheral neuropathy or having CAs do the shock wave. I read all the malpractice carrier journals, constantly reading, learning. I'm a sponge. I get emails from the OIG from all these doctors that have gone to jail convicted of insurance fraud. I want to know what these doctors did wrong. Look, this chiropractor's going to jail for 30 months. He defrauded the NBA Players Health and Welfare Benefit Fund. I know you don't want to read the stuff. We read the fine print so you don't have to. What did this doctor do wrong? And then we put it out, and hopefully you get our newsletter. We send out a newsletter about once a month to over 25,000 offices nationwide, and we give them these little horror stories. I don't show you this to scare you. I show you this to educate you, and you could decide what you want to do. Look at this chiropractor, insurance fraud, because he was using a technique he learned on YouTube. That's not okay. You can't use techniques that you make up in your garage. You can't use techniques on patients that are not taught in chiropractic colleges. Here's a podiatrist convicted of a $4 million foot bath screen. What did he do? The owner of a billing company sentenced to 1 year of probation. Healthcare fraud. Do you use billing companies? I would say 60% of the doctors we work with use billing companies. Have you ever asked your billing company if they have a HIPAA compliance program? Have you ever gotten a business associate agreement signed with your billing company? There have been updates to that. We stay up to date on all the HIPAA stuff. We've put in probably about 200 offices. We've installed HIPAA compliance manuals. They'll help you swan, sleep well at night. By the way, phases of care, I see these in notes. Doctors like to put in, oh, Mrs. Smith is in the acute phase of care. Mr. Taylor is in the corrective phase of care. I think it's a waste of time. I think it's confusing. I think it could mislead an auditor. You don't need to put in the phase of care, all these different phases. There's only two phases. Doctors, when you walk out of the room, you have to decide, the patient that I just saw, was that active therapeutic care or was that wellness maintenance care? You have to make that decision after every patient encounter. Active care, patient pays cash, or insurance pays because it's considered medically necessary. Maintenance wellness, the patient has to pay. Most insurance does not pay for maintenance or wellness care because they don't consider it medically necessary. However, some doctors get caught in the middle and have to give back hundreds of thousands of dollars. Education, communication, patient report of findings, one of the best ways to prevent state board issues. Have written policies. That's another form you should have, a written policy on your financial policies. It helps educate the patient about acute care versus chronic care, gets patients to understand that they're responsible to pay. It prevents doctor-patient upsets. Doctors, when you look out into the waiting room, this is how we train our doctors. We want you to look out into the waiting room and just think about how you're going to help the patient. There's Nancy. She has a herniated disc. There's Karen. She has knee bursitis. There's Norman. He has knee pain. There's Sally. She has sciatica. There's Hillary. She has headaches. That's all, doctors. You should be thinking about how to get patients well. Staff members, you're different. There's Nancy. I got to send Cigna the notes. There's Norman. I got to get an updated ABN form signed. There's Carla. I got to get a credit card update because her credit card just declined. Doctors, you didn't go to chiropractic school to learn how to fill out an ABN form. Delegate that out to your staff. You don't have to train them. Let us train your CAs. Oh, here's another target coding form, insurance non-covered services form. Back to your cash plans, your 36 visit plans. Make sure they're compliant. It's one of the common complaints that patients have. They didn't realize how much things were going to cost. Get familiar with your statements. Give patients walkout statements. We have tons of sample walkout statements, super bills. You want to fill out a 1500 form for a patient? That's nice. You could submit the claim. Just keep your fee simple. Fee confusion, the most common cause of patient complaints to state boards. All patients should be aware of your normal fees if you're providing discounts. If you don't do that, it's going to cause sticker shock. Just a few closing comments. Prevention is the key. You want to prevent problems. One of the best ways to prevent problems is to have policies and procedures on how you train your staff on billing and coding. Is it okay to waive copays, deductibles, and coinsurance? Most of you are saying, no, you can't waive copays, deductibles, and coinsurance. That's not appropriate. You're wrong. It is appropriate in certain situations. Target coding members, you know what they are. I'll give you one. If you have a Medicare QMB patient, a QMB is a qualified Medicare beneficiary patient that has Medicaid as their supplemental. You're not allowed to collect the deductible or coinsurance from those patients. There are situations where you can't do it. Now, I know some of you try to be nice guys. Oh, here's Mrs. Miller. You know, Mrs. Miller just committed to a 36 visit care plan. She has a $500 deductible. We're going to waive the deductible. We're not going to have her pay it. We're going to eat up the deductible. Yum, yum, eat up the deductible. So you think you're being a nice guy. An investigator looks at it differently. Investigator looks at it this way. You took $500 cash. You took 5 $100 bills. You put it in an envelope. And when Mrs. Miller walked into the office, you handed it to her. Yes, it's the same thing by waiving the deductible. So what did you just do? You just gave Mrs. Miller a kickback. What does that do? It violates the anti-kickback statute. Are you familiar with the Stark Law and anti-kickback statutes? If not, you don't have total control over your business. Background checks. If you see Medicare Part B patients, you are required to have a OIG billing and coding policy manual, and you're required to do background checks. I would say 80% of you listening to this are not doing it. You want to be a gambler? That's okay. We have clients, the speed limit on the highway is 70. They're driving 90, 95, 100. You don't want to be the one that gets caught. You should have a policy on documentation. Otherwise, you might get a post-payment audit. This doctor has to give back $250,000, easily avoidable. Now, here's a prepayment audit, which is good news and bad news. This doctor didn't have to give any money back, but now he got put on a prepayment audit, so we're helping him now. We've helped a lot of doctors with audits. Here's one. Good news. Doctor we're working with was billing Blue Cross Blue Shield of South Carolina, had to send in his notes. He's been following my rules and guidelines. Great client, following my recommendations. He gets a request to send in his notes. He was worried. I said, you're doing good. I looked at your notes, send them in. He gets a letter back. A review of the records you provided, we determined they meet the requirements outlined in our policies. Therefore, this audit is being closed. Great letter. Here's another doctor. Sent in her notes, we helped her. It says, based on the documentation reviewed, we found that all services were reasonable and necessary. We applaud you on your billing accuracy, and we encourage you to continue your current billing practices. Isn't that special? Isn't that a nice letter? By the way, we get this question. What software, EHR software program do you recommend? We love Genesis by Clinic Mind. We write macros for Genesis, so if you have Genesis and you want macros, contact us. We write policy manuals. Anyone interested in credentialing and HIPAA compliance, contact Natasha. Many of you know Natasha. She's the Chief Operating Officer at Target Coding. She's been with me for over 15 years. There's her email, Natasha at Target Coding. Scan that QR code if you want to set up a free consult with her. I mentioned my book earlier. I'm not going to go over it again. You should buy this book. It's an excellent book. We've sold thousands of them. You also get these cheat sheets to prevent the excludes one denials based on your diagnosis codes. Have you seen that? No? You're lucky. Any day now, you may get a denial and you don't know why. It could be because of the excludes one denials. For example, if you build low back pain and strain low back muscles on the same claim, you're going to get a denial. You might not know why. If you bill for a herniated disc and lumbar radiculopathy on the same claim, you can get denied. And you might not even know why. Disc degeneration and sciatica, can't bill both of those on the same claim? No. I send you this really cool spreadsheet, Excel spreadsheet, that shows you all these excludes one examples. So we offer a lot of seminars and webinars, live webinars on demand. Check out our library of on-demand webinars. Go to Target Coding, click on the on-demand page. You'll see a whole bunch of them. Great topics. These are our CA boot camps, 6 1-hour. Take your CAs through all 6 hours. They will be well-trained and help you doctors make more money. And in class number 4, we show CAs how to do the SOAP notes for you. In class number 3, we get into more detail on how to fill out the pre-authorization forms. Now we do some marathons. We do 6-hour webinars approved for 6 CEUs in over 30 states. These are the dates coming up. You should see them on your screen. We do them every other month, March, May, July, September, November. Become a member. It's only $99 a month, and you get access to tons of information. We're not a practice building company. We're not a practice management company. We are an educational source. We teach you how to do things on a regular basis to make your practice work better and become more efficient. $99 a month, pay as you go. You don't want to become a member? That's fine. Want to go just 1 hour at a time? We offer that too. All of the forms that you saw on this webinar come from my package of forms. You could order them online. You get emailed. You get them emailed in Microsoft Word. Just copy and paste them into your software program. HIPAA manuals, chart reviews, credentialing. We do things you might not even know that we do. Some of you think we just do free webinars. No, we have 14 products and services: laser, decompression, neuropathy, shockwave, chart reviews, tons of testimonials. We have options to fit every practice: in-network, out-of-network, Medicare, cash, PI. Please check with the carriers you bill prior to submitting claims to ensure it's compliant. We can't guarantee this information will guarantee payment from any company. Target coding is not responsible for any laws or rules that may change following this webinar, and you know they change all the time. So it's important to do your best to stay on top of these changes by attending seminars and webinars, and join your national and state professional associations. And there's Natasha's contact information. Here's my contact information. By the way, follow us on Facebook, Instagram, LinkedIn, YouTube. I just uploaded a YouTube video on shockwave billing and coding. Go to YouTube, put in the search target coding, you'll see my channel. So here's my email, info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. Yes, we have doctors that still like to fax us information. You don't have to white out or black out patient information. We have a HIPAA secure encrypted fax number. It's 1-844-831-2347. Would you like to set up a little time to speak to me? A free 15-minute consultation? Go ahead and scan that QR code. Or you can give us a call and set it up, or send us an email. All right, so again, I want to thank everyone for attending. I hope you learned a lot. Take care, everyone. Bye-bye.